Hi, and this is our, I'm Vivian Wilson, and this is our second speaker for the morning oral presentations. This is Brandie Bailey. She has been with Carilion since 2000. She started in CSPCU after graduating from Jefferson College of Health Sciences. Since 2000, she has worked in the ED and as a clinical administrator. In 2002, she obtained her BSN from Jefferson College of Health Sciences. And in 2014, she joined the leadership team in the Nursing Support Services as a unit director for the resource pool. She has served as the chair for the Blue Code Committee for the last 5 years. She continues to serve the community as a BLS instructor, and in her spare time founded a charity organization devoted to community awareness and education for cancer. So please welcome Brandie Bailey.
Hello everyone, I'm going to talk to you about overhead elimination and the silent solutions that we came up with the task force to talk about the support of Quiet Hospital Initiative. Everyone remembers Flo. All the way back to 1898, Flo talked about unnecessary noise and that it still hurts the patient. Years later, we are still having an issue, even though Flo talked about it 100 years ago. When we were doing our literature review, we found out that noise levels began to rise in the hospital in 1960. There's been a nationwide trend to decrease noise throughout the hospitals across the nation. They found that high noise levels contributed to decreased post-discharge satisfaction scores, alarm fatigue in caregivers, workplace dissatisfaction, decrease in quality of care. Also developed patient stress with increased respiratory rates, blood pressure changes, stress, and sleep deprivation. Most hospitals developed a way to implement noise reduction in their hospitals. This ranged from new technology to ceiling tiles, rubber wheels, soundproofing doors. At Carilion, the patient satisfaction scores showed that patients complained about slamming doors, large amount of noise coming from nurse's station, IV pumps, bed alarms, and overhead paging. About 2 years ago, Carilion launched an interdisciplinary team to look at the national benchmarks in rejoice hospital reduction. One of the things that we focused on was overhead elimination. Last June, in the summer of 2014, we were able to eliminate stroke alert, heart alert, code blue, code yellow, trauma alert, gold alert, and code secure for overhead paging. Presently, we are working on the implementation of nurse call and a new middleware system. That's something that's coming in the next 6 to 8 months. In the future, we'll need to discuss how we would be able to tell nursing about code oranges, grays, green, siege, how we have conferences for TransLogic or any kind of commuter conference, Lindbergh, Code E, and continued integration with Extension and other networks throughout the hospital. So once we did that in 2014, what do you think happened? So everybody got really confused about what was going on in the hospital. They didn't know if there was any codes going on, what's happening in the ER. Oh, they must not be busy down there because we haven't heard any trauma alerts. Totally untrue. They just didn't hear about it anymore. So everybody got really freaked out about that. And so what we really needed to step back and say, how are we going to let the hospital know what the pulse is going throughout the building? Nobody had any idea what kind of admissions they were going to get unless they used computer. They were so used to hearing that they were getting a trauma alert and they could expect that there was a patient coming to their area, or a code blue and they had the only ICU bed that was open, so they thought they were getting that patient. All that became very silent, so it was very confusing for people. And this also raised a list of issues for code blue. We found out that code blue overhead paging really should have been a secondary notification, but for a lot of people it ended up being a primary notification for these people, physicians mostly. So we needed to figure out a way to market and get a positive spin on how taking the overhead eliminations away was a good thing for patients and for everyone. Staff reported that they didn't really feel comfortable initiating the whole code blue response. They really feel like we lost their safety blanket. We took their overheads away, so they really didn't know if anybody was coming. We also needed to talk about, if you're getting paged constantly for these things, is that really too much for staff? Physicians also felt that they were delayed in being notified for their actual patients. Well, in the past they were notified by the overhead even though they weren't on call, but they knew that it was their patient was on that floor and they would go up and say hi and see if they can help anybody. But now if they weren't listed in the call system, they weren't being notified. Some of the things that we decided to do to counteract all of those issues within Code Blue is we identified the need for staff to participate in drills. Several floors have done this intermittently over the last couple of years, but there's no real standardized or systemized approach to this. The drills have been the best thing that people have recognized as helping them get used to that situation. We're working with the sim lab so they can have that piece with respiratory, with clinical administrators, with nurses from the floor so they can practice emergency situations. There's also going to be annual education in Cornerstone for rapid response, Code Blue, and escalation, which has been needed for quite some time for annually. We have seen a dip where we educate for a while, things get better, and then it slows back down, and then there's an issue again. We're instituting new technology with Extension, Rollin 5, and Alertus. You're going to see more about that in the next 6 to 8 months. We also have created a couple of different surveys for rapid response and Code Blue debriefing to find out what the barriers are for staff actually calling a rapid response or a code. We will be instituting Extension, which is the new middleware that's replacing Emergent, and the new nurse call system upgrade, which is coming this fall. We also have a new product called Alertus, which I'm going to show you about in just a second. Extension is our middleware that's replacing Emergent. Extension basically is an application that interfaces with things like Epic or Rollin 5 that is focused on delivering patient-centric alerts. So you can get text pages or alerts on your phone that the patient needs ice, or they need to go to the bathroom, or you have a critical lab, or you have a code in that room, or a rapid response. Currently, these are some of the things that Extension can interface with. We will be starting with Rollin 5 and Epic with the new extension that's coming, but it has the possibility to interface with all of those things and many more. So as we learn more and we talk about alert fatigue, we'll figure out where the best place is to alert your nurses. We don't want too much, but we want enough to get them where they need. With these calls, you're going to also get a new smartphone device. You'll also be able to change the alerts. So when you get constant pages, sometimes you have no idea the difference between an IV or an emergency down the hall. So we'll be able to change those alerts for high priority, low priority. They'll go to the nursing assistant if it's appropriate, or straight to the nurse if it can skip over the nursing assistant. They'll also be able to alert the treatment team. Some of you have heard Dr. Keys speak about the treatment team in Epic. We will hopefully be able to interface with Extension and Epic to notify the physicians that's listed in the treatment team right away for a Code Blue or rapid response. So there will be no delay. They'll get that right away. This is Alertus. This is something that we actually started trialing last week with Code Yellow. The inpatient world, as we discussed before, didn't really know what was going on in the ED and if they needed to change how they did their process on the floor. So last week we tested this on 12 West, that nursing will get this Epic message, this banner across the top, that they will be in a Code Yellow in the emergency department, and we'll see if that is very helpful to them. We'll be able to roll that out to other units. Since the institution of the Overhead Elimination Task Force, we've had 178 rapid responses and 108 Code Blues with no adverse events. The task force is implementing new technology that will be in the next 6 to 8 months. We will be getting a new smartphone with the addition of Extension that you'll be able to receive those alerts for nursing. And we will also be instituting the new Code Blue drills. And that's all I have. Does anybody have any questions about that? Thank you.